and I'm a naturopathic medical student at National University of Natural Medicine. You're listening to the Herbal Hour Podcast, where we have inspired discussions with healers, physicians, and experts on all topics related to holistic medicine, spirituality, alternative therapy, and healthcare. The future is integrative, open-minded, and inspired by ancient wisdom rooted in nature. This week on the Herbal Hour Podcast, we have return guest Dr. Loch Chandler. He is a naturopathic physician and licensed acupuncturist here in Oregon, and he specializes in adjunctive cancer care and integrative therapy. In this episode, we talk all about how to support your immune system naturally, your internal terrain, in the face of all these threats that are now facing us. How gut health is related to our immune system and how boosting your gut health can improve it. The role of genetics in cancer and how Chinese medicine views cancer, and how our emotional state, our mental state, and our levels of stress impact our health and our immune system, as well as things that we can do to improve our health. If you like the Herbal Hour Podcast, be sure to give us a like, a subscribe, and a comment. It helps us a lot and supports the growth of natural medicine. If you're the type that likes to watch the video of a podcast, this episode will be on YouTube on the Herbal Hour Podcast channel. Without any further ado, here is our guest, Dr. Loch Chandler. Once again, he is a naturopathic physician and licensed acupuncturist. Our last episode that we had was on integrative oncology. The idea of integrative medicine, to give some background, is the idea that conventional methods and natural methods and alternative methods can be used together and integrated. Thank you, Dr. Chandler, for being on the show. We had an excellent conversation last time about naturopathic oncology, natural approaches to those. You shared some great stories. I'd like to welcome you again to the podcast. Thank you for coming.
Thanks for having me.
Yeah. So today I wanted to talk about starting off, what can you do naturally for coronavirus? Because I know there's a mass hysteria right now about coronavirus. And I think there's a lot of misconceptions about how to approach it that someone such as yourself could help us out with.
Mm-hmm. A lot of the same approaches that we think about with regards to the flu or influenza are going to be applicable with coronavirus. But I'm going to go backwards a little bit to something that Louis Pasteur is quoted to have saying on his deathbed, which is, the microbe is of little consequence if one's internal environment is in order. So here we have the father of the germ theory and pasteurization, and very influential in the wine and cheese industry. There's a germ, a bug for every condition. And what he's saying near his death was saying, the internal environment is key also. And so that's, in a sense, a very Chinese medicine approach. We talk about that internal garden. And how susceptible is that garden to have that seed plant and grow? And in this case, how susceptible is it to have that virus plant and grow and proliferate? And so we're going to talk about the same sort of things that help overall health, and which translates to resilience and resistance to being, you could say, exposed to the COVID-19 or the coronavirus and then coming down with it. I often give an analogy. It's like if we're in an elevator, maybe the elevator's crowded, maybe there's 15 people, and somebody comes in on a floor and they're sneezing, coughing, and blowing their nose, and just, that they're sick. Out of that 15 people, all 15 are not going to get sick. It's like, who does get sick and who does not get sick are equally important. But it's how susceptible is that terrain to getting sick with the coronavirus. So we were talking about it, I was talking about it with my students just earlier today. What would you do? And that's why I was quizzing them. It's like, what would you do for it? It's like, so we know that we want to base the foundation in a healthy choices diet. If we're doing a lot of sugar, we know the immune system doesn't do as well with the sort of a high simple carbohydrate or high sugar diet. It just is not functioning as adequately. If people aren't sleeping well, we know that that reduces the immune system. We know if they're not hydrating well, we know that that is a key. And so hydration, I was asking a student, it's like, well, why is that? And so she was talking a little bit about it, and I was going into a little bit more about, hydration is going to impact our mucosal secretions and how moist are our passageways. And so if we're not hydrating adequately, we may not have good moist respiratory passages. And so a virus then can potentially travel deeper without getting trapped or glued or adhered to a moist mucosal membrane, which then enables it to get a little bit deeper in, that then may, if it starts to grow, can be more problematic. And so we're talking about the basics of what I call the goods: good food, good diet, good sleep, good hydration, good exercise, good mental emotional wellness. Because we know that when people are under stress, their immune system is not going to be as good as it is when they're not under stress. And so we can see immune cells being altered under states of stress and duress. We could even go into social support. And if they have a good social support, we know that their immune system is going to be healthier versus those who don't have good social support. So really thinking in a holistic manner about what could help them. But if we're going into supplements, it's like maybe probiotics, a healthy gut bugs. It's a great way to help support the immune system. A gut that's in balance is going to be a healthy immune system with regards to, it's not going to be stressed by having flora out of balance. The gut is about the size of a tennis court. And so if we spread out the surface area flat, so if the flora is out of balance or we're eating sort of things that irritate the gut, oftentimes wheat, dairy, sugar are common gut irritants. We know that from people with irritable or inflammatory bowel disorder. And so doing probiotics is a way to help support that. But then there's other things too that we could do to support from vitamin C or zinc, some of the different supplemental aspects that we could do to support it.
Yeah, there's definitely been an overemphasis of, containing the germs rather than, as you were saying, what is the reason that people catch it and what is the reason that people who do catch it, do better or they do worse. Because obviously people who are most susceptible are the elderly and people with other conditions. And that's just proving that the state of your body matters.
Right.
And I think, there's all this emphasis on washing your hands and scrubbing everything down, but so little emphasis on, healthy diet or, what you're doing to take care of yourself. And you bring up a really interesting point that I was discussing with somebody about the stress factor of it, right? So stress obviously suppresses our immune system. But what does a mass hysteria do to the immune system? Like, how harmful is it to actually be so afraid of something that you're possibly making yourself more susceptible to it? It's actually kind of ironic that in being very afraid of getting sick, you are actually making yourself more likely to get sick because, you're going into that fight or flight type, fear response, cortisol's going, immune system shut down. So what are some things that people can do to kind of calm themselves down, I guess?
For me, it's going back to the basics. And yes, stress is going to be a component. Is it going to be the silver bullet of whether you catch it or not? Probably not. There's usually, as you said, we know the elderly are more susceptible and they often have comorbid or coexisting conditions of ill health. And so we know that is going to be weakening their resilience and maybe increasing their susceptibility. And so that's the piece is okay, how do we just de-stress and take care of those things that we can control? It's so just to do those things of which that are in our control are diet, lifestyle, exercise, hydration, and hand washing. Semmelweis was correct. It's hand washing is key. And just, of course, there's the recent data on clean your cell phones. They're very dirty. And your computers are also very dirty. So just having good hygiene around the home, but also taking care of self and resilience. So you mentioned a good thing about the elderly too. And so we talked about that just with my students. And so one thing that I often see with elderly patients is they're often not eating well. And so there is some level of malnourishment. And typically they're not getting enough protein. And we need protein to run body systems. But then on top of that, we're going to help support our immune system. So if we're not getting enough protein really to run our body systems, our immune system may not be getting the nutrients it needs to really function well. And then digestive flora is often out of balance, and then our digestive enzymes may not be as well as they were or secreted as efficiently as they were when we were younger, in our 20s and 30s. And so what are the ways that we can support is really to support the gut health, getting adequate protein, making sure we're having good digestive enzymes. And that could be something as simple, especially for the elderly, maybe it's apple cider vinegar or a chewable papaya enzyme. And so it doesn't have to be fancy, but just something to help tone and optimize those organ systems.
Can you elaborate a little bit more on the connection between gut health and the immune system?
Well, just to reiterate, it's our immune system in its simple terms is really gauged to what's me, what's self, and what's non-self, what's other. So self versus other. And we're usually talking about, it's like a bacteria. Okay, it's not us. Or a virus is not us. It's so we're trying to differentiate what are those foreign materials that really should not be here, not be in my system, not be, on my skin, or at least into, maybe I have a laceration or a cut, so then it gets in, and the immune system's able to say, hey, you're not supposed to be here, so we'll get rid of you through its mechanisms of the immunology or the immune system. And so with that in mind, we take in the most amount of foreign material, or not us, in food. And so the digestive system is really at the front level of sort of facing what's not us. And so when the immune system in the gut is not competent, foods can be more irritating, or more what we call foreign material-like, or antigenic. And so causing that immune system to be on guard. And so if the bacteria aren't helping us digest food, if our enzymes aren't helping us digest food, and that translates to is breaking particles down into absorbable chunks, or getting it ready to pass out and excrete. And so if particles are a little bit too big or undigested, it's like that can potentially be more irritating the deeper it goes into the digestive system, and cause what's called, in a simple term, is leaky gut. And so if we have, typically in our gut lining, it's going to be a tight junction. And so as things may swell and get inflamed, that tight junction is no longer so tight. And so we can get some bigger particles in sooner than what may be typically seen by the gut. And then the immune system's like, hey, this shouldn't be here. And then the immune system gets activated and may cause more swelling and more leaky gut, or immune challenge. So the immune system's not really strong or weak, it's really in or out of balance. So if it's overworked, overutilized in the gut, maybe it's going to be underrepresented elsewhere, such as the respiratory tract.
That brings up an interesting point with food allergies. So there's this idea that, if you have this or that food allergy, that you should avoid that food. But typically, obviously, and you might have seen this in your practice, that people who have food allergies tend to have a lot of food allergies. And there's kind of this rising theory that it's the kind of leaky gut thing, where it's not that they're really allergic to it as much as these particles are getting into their blood and into their body where they shouldn't be, because a normal gut lining will kind of keep everything contained and they'll go out. But if you start, it starts going through the leaky gut, then it can affect people that might not otherwise be allergic. So what are some key approaches for kind of healing that lining? Does that involve like probiotics? Does that involve like what diet you eat? Does that involve fasting? What's the take on that?
That's a great question. So there's a lot of ways that you can approach healing the gut. It's like flora is going to be a component of that. And whether you think about supplementing or just doing fermented foods in a state where the gut is really not in balance, fermented foods may not be enough fast enough. And so we may need to do more of a targeted approach with a high quality probiotic. And so that is one aspect. Digestive enzymes is going to be another, because that's going to help break down particles. The diet is going to be another piece too. And after I've done thousands of food allergy tests, and I'm more likely to see repetitious foods in the diet. So the take home for me after doing thousands is to say repetition can create irritation. Meaning that if the gut sees a food over and over and over again, or multiple times in a day, the same food, and I'm more concerned about people who are on restrictive diets, such as vegan or vegetarian, which translates to it limits our food box that we are choosing from. And so the more likely that we're going to see repetitious foods, the more likely I'm going to see either a food allergy or a sensitivity or intolerance to that food, mostly due to repetition, creating irritation.
So what you're saying is that the foods that we eat very often are the ones that we're more likely to react to allergically?
I'm more likely to see a repetitious food than I am going to see a food that's not repetitious. Now, there's what I call sort of constitutional irritants. For some people, it's like they can't do shellfish. It's like, okay, great, we know about that. And others, where I would see, for example, I'd have food tests come back and it would be like cashews would show up. Now, granted, some people can have food allergies, but then in talking with the patient, they're saying, oh, that's the main nut that I snack on, and I probably have it at least 2 to 3 times a day. It's like, okay, so what's going on here? Or I would see chicken shows up. It's like, well, I'm trying to avoid red meat because that's not good for me, right? And so that's a whole nother discussion. But foods that they eat consistently can be more likely to show up. But I'd see it to soy, and the person's a vegetarian or vegan, and they're doing it breakfast, lunch, and dinner to get some protein. And so, again, foods aren't bad. I think they're badly eaten. Meaning that repetition creates irritation.
Mm.
But I wanted to address another thing that's very important. Okay, so we're talking about food choices. And so I try and take that variety is the spice of life saying to heart and just say, okay, I don't like a strict rotational diet, but trying to just get variety. Most Americans eat like 20, 25 foods. And if you go into the grocery store, like into the fruit and vegetable section, there's a lot more than that. And so it's just trying to get outside of our norms and sort of our habits and just to say, how do we broaden that out? Just to create more variety. So if we get variety of foods, if we have good healthy flora, if we have good digestive enzymes, another important aspect is stress. So going back to our nervous system, we have the parasympathetic rest and digest, also sympathetic fight or flight. If we are predominantly in fight or flight, what that is prioritizing me running away from the proverbial tiger behind me. And to say, okay, to run, I need blood supply to my eyes so I can see, to my brain so I can think, to my heart so it can beat and move the blood, to my muscles and my lungs. It's like digestion, reproductive is not a priority at that time. And so what happens is blood supply is reduced to the gut. We know blood supply is very important for healing of tissue. So if there's an irritation or inflammation, but I'm under sympathetic stress a lot, I may not be able to heal that adequately so I can perpetuate an inflammatory condition.
So I think maybe on one of the shifts I was on with you, we talked a little bit about the migrating motor complex and how fasting allows that to work and allows our gut to heal. What role do you see for water, juice fasts, things like that in healing the gut, healing chronic conditions? I know you adjunctively treat a lot of patients with cancer, and fasting therapies are, of course, like one of the go-tos. And I also have some more questions on that because that's always an interesting topic.
So right now we're seeing a lot on fasting and diets like the ketogenic diet and just what role does that play. And so we don't have a lot of good data with regards to fasting. And so what I mean by that is like we don't have sort of studies where they've taken people who fasted with a control group and then just seen how are they responding, how are each of them responding. So what we do know that it does seem to help with regards to symptoms, where the jury's still out with regards to how is it impacting the cancerous process. So it may help alleviate some of those fasting symptoms. What I'm always, or the cancer treatment symptoms, what I'm concerned about always, though, with the patients going through cancer is getting adequate nutrition. And so we talked about the importance of protein and running your immune system. And when you're fasting, you're not eating. And so with people who fast, I'm always asking them, it's like about their weight. And are they losing weight? Because I don't want them to start losing their lean muscle mass or telling that sort of that response by saying they're not getting the adequate nutrition or adequate calories or adequate protein, and so we're losing muscle mass, which is a stress to the body, which is the exact opposite way that I want to do. However, sort of the intermittent fasting seems to be helpful with regards to regulating our blood sugars, and so which can be also another tangent of which we can help support the immune system with a better regulated blood sugar balancing system. And so that's just another avenue or another nuance to go. But at this point in time, really, I don't want people to worry about food. It's just trying to get variety, trying to get adequate protein in for those patients who are going through cancer treatment, and to know about when we do something like intermittent fasting, which is typically from 12 to 14 to 16 hours, it's like it seems to help with regards to our insulin sensitivity. So our body's response to insulin, in that we're going to be more responsive to it as opposed to insulin insensitivity or insulin resistance, whereas our body may not respond as adequately to insulin. So meaning that we're regulating our blood sugar response better. And again, that seems to be an important role with regards to our immune system because it seems to help with regards to patients with cancer.
There's this idea amongst kind of the more natural therapies for cancer that cancer tends to thrive on sugar, and when you cut it out, it's not able to grow as well. And then also there's another idea that cancer cells are not as able to respond to like big stresses of the body, like a fasted state, whereas healthy cells are more likely to survive that because their metabolic systems are obviously better. Obviously, they're more functional, whereas cancer cells are just they're just gone off on the wire. So what's your take on that? Do you think that that's an aspect of why like sugar and fasting might have an impact?
And so I get that question a lot. So one of the common questions that a cancer patient would ask is, I've seen online or I've heard that sugar feeds cancer.
Mm-hmm.
And I've seen some responses to that, in literature from big hospital systems, including Memorial Sloan Kettering, etc., that are saying no. And it's like, well, if we're being honest about physiology, it's like sugar feeds every cell of the body. I mean, it's a preferred fuel. And so how can we say that it doesn't feed cancer? I think it's a more nuanced approach, though, than that. We can't just stop there. And so it's more of what you're talking about. It's like we know that sugar feeds every cell of the body, but cancer cells are consuming nutrients more rapidly. And so if we have more sugars in the system, it's just going to be able to eat more. And so that's where the fasting sometimes can sort of rein that in a little bit. And whereas a healthy cell, which is not trying to grow without stopping because it doesn't know how to stop, it's like taking the brakes off a car. It's like then they can deal with those lower sugar states. Whereas a cancer cell, it just wants more and more. And so it struggles when that substance or that source is not there anymore. And so it can just impact its ability to, in a sense, live. But I always like to reframe it. And so cancer cells aren't, I wouldn't say they're good or bad, they just are. Evolutionarily, they're part of just how we evolved. It's like there is a DNA damage, and that, it's going to lead us down this one path if we can't repair it. And so you could say that's been an evolutionary aspect, but with regards to health, it's like it can be fatal just with regards to having a tumor that interferes with body functions. And so the body's translation, when we turn on these oncogenes that are in these cells, these cancer genes, they're often utilized if I cut myself, to grow and repair. They're utilized when the baby is in the mother's belly, just to cause growth. And so these genes turn on, but it's when they lose control that then they can become a problem. And when they bypass our immune's ability to see them or deal with them, then it's a problem. And so we're trying to do everything we can with regards to going back to the original question of sugar and blood sugar control. It's like, okay, we know that when we eat a healthy whole food choices diet, we're getting fiber, roughage, protein. These things are diluting some of those sugars or carbs that we're going to get out of a fruit or a vegetable, which again, we need some of those nutrients. But when I have more of the pastries, the cakes, and the cookies, it's like my blood sugars are going to be higher, and maybe higher for longer periods of time, which is giving my body fuel that it may not need, especially if I'm carrying more pounds than is ideal for my frame. It's like, so for me saying that maybe my blood sugar regulation is not as optimal as it could be.
You bring up a really interesting point about the genetics aspect of it. So there's obviously a lot of money, time, and effort going into researching, what gene causes what. Like, this is the gene that causes Alzheimer's. But you bring up the point that even a gene that seems like it's defective can have beneficial uses, like in the oncogene case of like healing and repairing. What do you think the future role of like gene therapies and understanding genetics is in cancer? Because that seems to be the way that they've the system in general has gone in terms of research. They want to know what gene causes cancer. Can we, get rid of that gene? Can we?
And so that's where what they're trying to do is to do some of the SNPs, or they're trying to sort of repair some of that DNA anomaly and then propagate it or enhance it to basically take over in a healthful way. So they're trying to, in a sense, steer the ship down a road that is going to be more healthful by manipulating the DNA or the genetics. But a lot of the targeted therapy or immunotherapy is trying to interrupt one of these oncogene or pathways that the cancer cell may be using on its journey for growth. And so it's trying to put the brakes on that aspect, but then maybe some of those immunotherapies are trying to unveil the cancer cell and help support or drive the immune system. It's like, because there's some methods that the cancer cells use is basically to cloak themselves and become invisible. And so how do we uncloak them and then stimulate the immune system? So there's different ways that some of these immunotherapies or targeted therapies work. And so it's the mindset, though, is thinking more about how do I sort of kill the cancer or interfere with the cancer, from my standpoint, and that's part of the integrative medicine, is like, how do I optimize the terrain? How do I optimize the overall health and wellness of this individual? And to me, the best would be doing that plus a targeted or immunotherapy. That to me would bode well better than just doing one or the other.
Have you heard of these new immunotherapies where they take the person's like own immune cells out of their body and they basically train them to be like super soldiers, and then they put them back in the body? They do that obviously in a lot of different ways, whether it's like exposing it to the exact, biological tags that cancer has on it so that they kind of get used to what they're looking for, or sometimes like genetic modification of the cells. Do you see a future in that as medicine progresses, of like using the body's own tissues to heal itself?
Oh, I think there's definitely going to be a potential application for that, almost like a vaccine, or just a way that you can sort of signal the immune system to be more on surveillance for a certain cell or aspect. And so, science is growing exponentially, and just with its regards to what it can and cannot do. And I think that we're going to be able to do more and more. But I'm always focused on what can I do to help the underlying terrain. So to give you more of an example of that, I've had people come in and they want me to, in a sense, kill the cancer. And so that to me is not the way that I really work. It's like I work to support the system. It's like I don't do the healing. It's like I help them help themselves to the degree that they can. It's like we're going to work together, and I'm going to give them the best information I know about with regards to what is the diet that they should be eating. How can I help them go through their treatment with minimal side effects and the highest quality of life? And then how just help them respond to their treatment better. And so that's really sort of how I'm trying to work with them. But I've had people come in and say, okay, help me kill the cancer. It's like, well, how are you eating? It's like, well, I have frosted flakes in the morning, and, I usually have, maybe I'll eat at a fast food restaurant for lunch. And okay, well, what are you doing for exercise? Oh, I don't have time for that. I'm too busy, working. Or it's like, how's your sleep? Well, it's not so good. I probably get 3 or 4, but it's broken up. And it's like, so we have these other foundational aspects that they're not doing. They want me to sort of help them with the cancer, but they're not eating well, they're not sleeping well, they're not exercising. And we have much more data on the power of nutrition, the power of exercise. To me, it's like the lower hanging fruit that is going to be much more beneficial for them than me giving them an IV, IV vitamin C, that we don't have great data on, but we're missing a lot of more a bountiful harvest with regards to the basics that they're not doing.
There's this idea that cancer doesn't happen overnight, that it takes 10, 15 or more years of all sorts of deficiencies in lifestyle, like whether it's sleep or diet, that all these over a long period of time put the body in a more compromised state, and that makes it more likely for something like that to happen. I think that also relates to bringing it back to like infections and coronavirus. It's like one doesn't catch something all of a sudden. It's like, what are the couple of months before you got sick look like? I mean, there's a strong relationship between stress levels, how you've been feeling about your life, if you've been feeling run down, that puts you in a state, and that doesn't just happen overnight. You don't just like suddenly have an immune deficiency and then the next day you catch the thing. There's much more subtle factors.
Oh, it's very nuanced. I would say good health doesn't happen overnight, and bad health doesn't happen overnight.
Yeah.
And with regards to cancer, it would be very rare for a cancer just to proliferate from nothing. I mean, I've had patients where something has showed up over weeks to months, but yes, typically cancer has been there for 5, 10, 15 years before it's detectable, as in by a lump or symptomatic, or it's going to exhibit or cause symptoms like anemia or fatigue or weight loss that then is going to cause further investigation. And so that's the piece. It's the same thing with the coronavirus. It's like, so we know the majority of the people that have died are sort of over 60, 70. They typically have those comorbid or coexisting conditions. They're typically in either a hospital or a long-term care facility. It's like, so they're not healthy people. And the majority of people are going to not really know that they have it. And that's why I think we know that right now it's over 100,000 cases worldwide. We know roughly between 3,000 and 4,000 deaths have been attributed to it. My guess is, and so the fatality rate is higher than the flu for sure. And so if we think that the flu may kill 0.1 versus corona, which is 2 to 4%, so out of 100,000 people, that would be about, for the flu, 100 people. But we may have underreported the amount of people with corona because we're not testing everybody. And so people, 96% of people may just think that they have cold or even at this time of year, allergy symptoms. And so not really go in to get tested or be impacted in a way that is going to be potentially fatal. And so that's the piece. It's like we may have underreported the amount of people with the coronavirus. And I think if we were more accurate, we'd probably see that the death rate drop to maybe somewhere closer to the flu, just because we probably don't have a complete picture of where we're at right now.
Yeah. Sometimes I wonder if our ways of trying to contain the spread of it are actually making it worse. Like the idea of like viruses mutating, like you basically, they say with all those antibacterial, antivirus, soaps and washes, it's like kills 99.9% of germs. It's like, but the 0.1%, those are like, super germs. And
right.
Are we just creating like even more virulent strains by being overly focused on like disinfecting our environment?
I mean, that's a great question. And so if we go step back to the flu virus, we know that they mainly picked the year before 4 out of potentially 16 strains to then grow and make it vaccines out of. And so really it's luck whether they get, a complete match of the 4, or they typically get 1, 2, maybe 3 out of the potential 16 strains, of which then they're trying to aim for next year. So it's really a guessing game that way. But yeah, viruses adapt rapidly, many generations within a day. And so, like you said, it's survival of the fittest, or almost that Darwinian approach. And so that's why, to me, if we focus on containment, that is a piece. And so good hygiene, Semmelweis, washing the hands, making sure we're cleaning. But there is something to a hyper clean, hyper sterile environment that actually is a disservice. We know with regards to kids, we know that having too sterile an environment is actually can predispose them to childhood cancers. And so we know that when kids have dogs, they're actually healthier. It's like when you get a dog that's licking your face and they've sort of been in the dirt and everything like that, it's like that's actually helpful for your immune system, in a sense, for your immune system to practice. And, we want it to be exposed to these foreign materials, foreign pathogens. Most of the time are going to be not impactful for us. And so, but it helps our immune system practice. Like the analogy is like, if I want to get better at basketball, I shoot baskets. If I don't shoot, I'm not going to get very good at it. And so it's our immune system's the same way. If we don't practice with exposures, then our immune system may not be competent. And then if we stress it in ways such as not a healthy choices diet, not adequate hydration, not good sleep or rest, then we're going to be affecting it in sort of a double whammy way.
Yeah, and that's especially the case too in like gut health, right? So I've heard the idea of like having overly sterile everything also has a problem for gut health. Like there's some people who advocate even, letting kids play around the dirt and get all sorts of weird things in their mouth, and they don't, interfere because they believe that that's part of the like immune and gut training process.
Right. I could say we would have millennia of experience of lack of hygiene, and we didn't it served us to a degree. And so we know that the hyper sterile sort of sanitary conditions are not always better for us.
I've heard that they also increase like allergic responses, the like Th1 and Th2, where I believe Th2 is allergy, right? And Th1 is infection. Like those are the T helper cells. I think I'm getting that right. But that they're in a kind of balance where it's like if you're having really, really strong allergic symptoms, your like immune response in terms of infections is lower, and vice versa. That if you have an infection, your allergic symptoms are less, or if you're exposed to things like that. And I wonder if our sterile environment isn't actually part of the cause of a lot of these weird allergies that are just happening to people.
I think that's definitely a consideration. And again, if we're not able to help practice with our immune system, our response may not be representative of a balanced immune state. It might, in a sense, freak out at this littlest thing, whereas more of a balanced, measured approach would be more realistic.
What's your take on this this new idea that cancer is actually a metabolic disease?
I think that there's a component of that, and so we can't. Making things black and white is usually not realistic in life, and so there's always shades of gray. And so, what is the metabolic components of that? But what I would say is, how is metabolics impacted by diet, by nutrition, by healthy gut flora, by having an immune system that's practiced, or by having a body that's not stressed, that is sleeping adequately? How is that going to impact the metabolics? We know that the metabolics are impacted by all those things. And so that's the piece of how do we optimize the terrain with doing some of those things that I mentioned should help you optimize some of the metabolic components. That is what we're trying to optimize too.
Have you noticed any consistency or any patterns in patients that tend to have cancer? Like, is there any kind of emotional qualities that they tend to have? Is there any diet patterns? Is there anything that you've kind of, out of seeing a lot of people with cancer, like, that's weird, people with cancer tend to have this, or this is happening in their lives?
It's a great question, but I'm going to, typically there's no black and white. There's a various shades of gray. One thing that I would say, it's common for me to hear patients who are diagnosed with cancer to talk about a significant stress event in the previous 1 to 3 years. And so that could be a death in the family, or one patient, it's like they had a person die for the previous 3 years, from a parent to a grandparent to an uncle to a close friend. And it's extremely stressful for them. To a divorce, to maybe one of their children got sick, or something happened that was significant in regards to stress. And, again, that's not going to be for everybody, but it goes to how's the immune system doing under states of stress or duress.
Have you found any ways to minimize the impact of those stresses? Because obviously those factors are unavoidable. Death, in the family, or of a loved one, or divorce to some extent. Those are things that kind of happen to us. But what's the difference between somebody who responds like healthily to it and doesn't get sick, and somebody who gets sick? Like, what are they doing differently?
Well, again, it's going to, Chinese medicine with that yin-yang symbol, the black and white swirled symbol that we see with regards to Eastern medicine, is telling us about the importance of balance. And so they're saying, I think we talked about it last hour, is that when the body's in balance, we have health. And so really, we are going to have those things in our life. We're going to have times of stress. And so to me, it's like a teeter-totter. If I have things that really stress me on one side, what's the other side that I can do to help me cope with that? And so that's the piece. It's like, okay, those things that I know help me cope. It's like getting outside, exercising, eating well, sleeping well. And so just knowing that when you have those tremendous stressors, it's like, what are you doing to help yourself and to help yourself cope? That will help with resilience. Maybe it's going to get acupuncture or massage or going for a run or going to work out. It's like, so what is that that's helping you balance, which will help you cope, which will help you and your immune system?
Right. So we touched briefly upon what your practices are for, coping, for self-care. And you mentioned getting out into nature, like hiking around, things like that. What about that is healing to you, like personally? What's your experience of, going out into nature?
When I think about going out into nature, it's from feeling the sun or the rain on my face to feeling the breeze, to seeing the birds and seeing sort of the life that's out there. Like just this morning, walking my dog, I was walking along our creek, I saw a beaver, and it was just gnawing on a stick, and it was just there, just sort of existing. And so it's a great way to get out of myself and just focus on the present moment. But just being in a world where we don't have concrete and don't have skyscrapers is just a nice way to help support my immune system, because we have data, the Japanese call it forest bathing, just about supporting my immune system and decreasing my blood pressure and reducing my cortisol response and my stress response. And so we know it's going to help me sleep. It's like, so just trying to do those things to help balance my life besides trying to eat well and to sleep well and to hydrate well, just to do the basics, just to support my own immune health. So I am more hopefully resilient against COVID-19 or the coronavirus.
Yeah, you certainly seem like you'd be. You strike me as a person who tends to be very like present and mindful. I think that is way more beneficial than most people give it credit to in terms of stress. Now, I was wondering, what is the difference with how Chinese medicine views something like cancer versus the more conventional approach?
Great question. So going back to balance, it's like, so that's really what Chinese medicine would say. It's like, so whether it's cancer that somebody has, or maybe it's high blood pressure, or maybe it's irritable bowel, maybe it's headaches, maybe it's knee pain, Chinese medicine would say for all of them, those aren't the problems. They're a symptom of an imbalance. So how do we help people balance with regards to knee pain or some of the drivers of blood pressure or with regards to cancer? So in one sense, cancer is a downstream factor of something that has occurred upstream. And so maybe that was an exposure to a virus. Maybe that was cigarette smoking. Maybe that was excessive alcohol. Maybe that was genetics, but maybe that was they didn't eat well. Maybe they were overweight and didn't exercise. I mean, so there's a lot of nuanced factors about that can lead to that balance. And so in one sense, it's like, okay, how do I help people balance when we're just thinking about all those things that make them them?
Is there a difference between cancers? Because we think of cancer typically as being cancer, but there's cancer of every different organ system. And I always wonder, like, what's the difference between the different kinds of cancers in terms of which organs they manifest in? Is that more of a showing us that there's some kind of underlying pattern in those, that maybe, liver cancer is actually just fundamentally a dysfunction of the liver over like a long period of time? And from Chinese medicine, they look at things like the liver and also metaphorically and energetically.
And so, yes, I mean, we can get cancer in any tissue. And so what is being affected and why? That's another question. It's like, so we know with regards to the skin, we know repeated sunburns. It's like people with my complexion. It's like, okay, I'm likely going to have to deal with skin cancer at some point in time just because of the amount of sunburns that I've had over my life. Because when I was young, we didn't have really sunscreens readily available and effective. And so going to the liver, it's like, okay, well, we know that hepatitis C, is going to be one of those causes. We know that heavy drinking and cirrhosis is going to be a potential factor. What's going to be irritative and inflammatory? We know that cancer is often there from chronic inflammation. And that's a very simple term, but that's really what we're looking for. It's really, what's the chronic inflammatory cause? For people who smoke, just inflammation with regards to the lung. And so the body's response is to try and heal that irritation, inflammation. Try and heal, try and heal, try and heal. And then with that DNA replication, cellular division, it's like then we get a DNA error. And that error is like taking the period off a sentence. That sentence runs and runs and runs. But it's often that chronic inflammation that then is driving sort of that healing response. Again, it's like, I like to reframe it again and say it's like cancer is not bad. It's just a cell that has tried to heal, and there's been an error in the DNA that then is usually not a good thing. And the immune system hasn't been able to take it out of existence, which it usually is doing. It says most of us will have been dealing with cancers at one point in time, often. And so, but typically our immune system is able to target it, maybe because of how we've been living our life. And so, but then at some point, maybe something happens where it's able to gain a foothold and then continue on.
It's an interesting point that, if an area is injured, the body tries to heal that. And the more it tries to heal that with like cell proliferation and growing more cells, the more risk there is of a cancer happening. Our body also has ways of fighting against cancer all the time because little cancers sprout up in our body all the time. It's actually pretty common. And I know there's actually a pretty ancient history too of people having cancer. It's not just a new disease.
No.
It's been around since humans.
Dinosaurs had cancer.
Really?
We know that.
That's true.
There's evidence in the bones of dinosaurs that they've had tumors.
Wow.
I mean, so it's not, but again, having DNA damage is a part of evolution. It's just a matter of, in a sense, Darwinian is the survival of the fittest. It's like, Lewis Thomas said that without DNA damage, there would be no music. Something to that effect, paraphrasing. It's like, so to take us from the primordial swamp and to cause some DNA damage that then evolved us into who we are today.
What factors do you think specifically shut down that body's response to be able to overcome that cancer? Are these more the lifestyle factors that you were speaking about and the immune system in general?
That's a great question. And so that is sort of trying to tag into, what can we do to help this person
how can you
balance?
prevent it, basically?
And so, again, we know that there's a chronic inflammation that then is typically leading to cancer. Like with regards to colon cancer, we know that the choices of the diet, if there's been more of a standard American diet, which is typically processed, packaged, preserved foods, low fiber, because we know fiber is extremely important as in a sense, an antidote to getting colon cancer, just because that's going to help with regards to the gut and the flora in the gut and the bacteria in the gut, just to set up an anti-inflammatory state. And when we have imbalanced flora, more irritation, inflammation from processed, packaged, preserved foods, low fiber, etc., that we're more likely to have irritation in the colon lining over and over and over again, trying to repair, and then a cancer arrives. So that's the piece. It's like we know that causes of cancer, nutrition is 30 to 35%. Exercise translating to body weight is probably another 25 to 30%. So right there, we're at 55% by how we eat, how we move our bodies and exercise. And so I like to sort of look at the causes of cancer. I mean, we have genetics, 5 to 10%, viruses, bacteria, alcohol, smoking, other big sources of cancer. But it's like, okay, how do we flip that and say these are causes of cancer? How can we use them as opportunities? And so that's where, from my standpoint, it's like we know that following a Mediterranean diet is anti-cancer because it's anti-inflammatory, but it's also nutrient-rich, fiber-rich. And so is it helping reduce inflammation or helping with healing? It's probably a little bit of both.
It's also delicious, too. So that has those factors, like, gotta have some falafel in your life.
Yeah.
Do you think that there's, like, spiritual and kind of more energetic factors that play into cancer? There's people like Louise Hay, who kind of outlines the specific cause of different kind of cancers. And of course, it gets a little bit subjective at times with like, how do you decide that, one example is people who tend to get throat cancer, people who don't speak their truth, or they get liver cancers because they have suppressed anger, because anger is related to the liver. Do you see anything like that? And what's your general take on like the more energetic and spiritual aspects of cancer?
Again, as a good biologist, always and never should be avoided. And so to stereotype people, I don't think serves us well. For some people, I think that there may be some truth to that, but it's something that they have to investigate for themselves. And so, like being a physician, in a sense, is just asking a lot of questions and just seeing. And so you mentioned that the emotion of the liver with regards to Chinese medicine is anger. All of the organs have an emotion. The liver's is anger, depression, irritability. And so how does that apply for, it's often with regards to breast cancer, viewed through the liver, because the liver rules the size of the body, and they would consider the breast as sort of the size of the body. Other people would say, no, it's the stomach channel. So it depends on what school of thought you're coming through, but oftentimes through the liver. And so how often is that where you have a woman with breast cancer, but then she has a history of depression? So it's not going to say, oh, that was it. I'm not saying that at all, but it's just saying, well, how did this play a part in potentially sort of what is going on? But more importantly for me, it's not looking backwards, but it's moving forwards and saying, what can I do to support sort of reducing that history of depression if it's still going on, to move forward and to create better balance?
Yeah.
I mean, so that's the piece that I think is more important. It's like, yes, we can look at sort of past history, but I think the ability to ask the question and just have the person be introspective and to say, nope, that's not it at all. Great. Or to say, wow, I hadn't thought about it that way. Because I have breast cancer patients where anger was not an issue, and then others where anger was a definitive issue. For example, I had a patient, she and her husband were separated. They weren't divorced because they couldn't afford it. And he was living on a different floor of the house, and he was also dating other people. And she had tremendous anger about that, understandable anger, but also frustration. And so for me, it's like I couldn't help resolve sort of the divorce or the living situation, but it's merely how can I help her balance today, either with acupuncture or with herbs or with diet, just to help the liver or help to decrease irritation, inflammation, and other ways to help her cope and be more resilient, going back to that teeter-totter. And so, again, I think just the most important thing is just to ask the questions and to be an observer or observant, and just to say, does this shoe fit or not?
So you studied acupuncture, Chinese medicine, naturopathic medicine, and you also work within a more integrative setting along with conventional practitioners like MDs. So you have obviously a pretty wide knowledge of what could be considered like almost 3 different kinds of systems, and then maybe more depending on what else you're interested in. How do you choose which way to go? Like, how do you choose, this person gets acupuncture versus this person gets Western herbs versus this person gets the Chinese formula? Or like this person gets all 3? Or how do you figure that out? That's always something I find fascinating, because they are such like seemingly self-contained, distinct systems, or at least they portray themselves as such.
Well, great question. I think a part of that, though, is what is the patient willing to do?
So I guess one of them just automatically falls off, like, I don't do all that herb stuff. So it's like, okay, we don't do any of the herb stuff.
Exactly. Or maybe they're only comfortable in one way. And so really, I don't do too much of the herbs just because as they're going through treatment, we don't have enough data. There's very few formulas that have been studied with regards to people with cancer in a studied way, as in, they're taking a group of people using these herbs, a control group who's not doing these herbs, how do they each respond? Because the most questions I get from an MD is often via an email or something. Hey, I have a patient on these things. Do you see them impacting their liver function at all? Or, hey, this patient's liver enzymes are going up. Is there anything you're giving that is causing that? And so for me to look back and say, I've seen patients where they've been on herbal formulas, and the oncologist has said, their blood work is not responding like it typically would. What's going on? And so I've asked the patient, it's like, because I've looked back over their history, it's like, wow, I don't see anything that is causing that. And then I'm talking to the patient, it's like, oh yeah, a friend of mine gave me this Chinese formula. And it's like, when did you do it? And so I've been on it for 3 weeks. And so I go back to blood work 4 weeks ago, blood work 2 weeks ago, and there was a noted difference. And so just having them, in that case, I had them stop that formula, and their blood work responded. So we could say that it was antidoting the effect of the chemotherapy in a sense. But I've had other patients where, I'd get that call and I'd be, their liver enzymes are going up. And so it's like nothing that I was doing was causing that, but then they're on another formula, typically from outside of the system, that then was slowing down liver function, that was making it more toxic. And so the bottom line is the herbs may process the chemotherapy too fast to where it's not effective. They may slow it down, which then is going to make it more toxic. And so we really need to have caution with regards to what we're exposing the body during times of treatment. It's like usually when they're done with treatment, that's more of that freedom to be able to utilize those Chinese formulas that maybe aren't as well studied, where we're not as concerned about impacting liver function in a certain way. So it's really, one is, what do we choose to do with this patient? What are they willing to do? What are they able to do? And some people, it's like, no, I can't afford that. It's like, so what we really have to think about a few areas of sort of the parameters of which we can work with patients.
Do you find the ideas and the concepts between the systems kind of melding together in your mind? Like for me, for example, things just like automatically connect. So like when I learned that, liver is associated with anger, and then I learned liver from more conventional like biomedicine perspective, those ideas all informed each other. Like they all became like this one general idea of like, this is all stuff related to the liver. There's this take on it, there's this take on it, there's this take, and they're probably all factors somehow.
So I think that all that is information.
Yeah.
It's like a 500-piece puzzle. It's like the more pieces that you have, the more of an image that you're going to be able to get. And so and what I often start with is just sort of the review of systems. Like how's the patient sleeping, eating, exercising, hydrating, etc. The moods, how's the weight, what's the treatment that they're going under, what about them, and what are they able to do, willing to do? And so it's like all these factors are playing a part into sort of the direction. And so it's really more of an individualized approach, and it's hard to cookie cutter it into a one size fits all.
That's the way I like to view it too, that everything, any kind of idea or concept is just a map of reality. The reality is what it is. It's incredibly complex and mysterious, especially when we try to define it. But all these different ways of looking at it, they give more information about what it is, but ultimately, the map is not the terrain. The system is not like the truth in any, like, it's more of a way to formalize and perceive and understand what the truth is, in at least a portion of it. So that's kind of how I look at it. What do you like to use acupuncture for? Like, what have you seen it most beneficial for?
Oh, I use acupuncture for almost anything.
Right.
And so it's a tool. And so it's one of those things. And some people are like, oh, I hate needles. I've seen enough needles, with their treatments. It's like, okay, well, what about acupressure? Or, there's other therapies that you can utilize, from shiatsu or just other forms of body work, etc. But with regards to cancer treatment, there's data on acupuncture and nausea, or acupuncture and neuropathy, the numbness and tingling that can happen from some of the treatments, or acupuncture and pain, or acupuncture and lymphedema that could happen, like have a head and neck cancer patient having some edema around the neck just post-surgery and post-radiation, and it's helping sort of reduce some of the tightness of that lymphedema and swelling, to lymphedema of a limb. Just sort of, there was initially a big fear about sticking needles in. This goes back to when I just came out of school, 20 years ago. And they thought that, okay, don't do blood pressures, no needle draws, blood draws, no acupuncture. It's like, but, the data didn't support that. And so a recent study by Barry Castellet out of Memorial Sloan Kettering, they were looking at, okay, is there going to be an adverse effect of infection? And so that was the main purpose of the study. And what they found is it didn't increase the risk of infection, and it actually decreased circumference of the lymphedema arm. So done appropriately by somebody who knows what they're doing, it can be effective to reduce some of the lymphedema of a limb. So, it can be used for most things. And just, it's a matter of experience. And so people often ask, it's like, well, I've got a friend in New York, or I've got a friend in Georgia, do you know anybody there? And I often, there are times where I do, but oftentimes no. And so just, if you're interested in getting acupuncture for those treatments, it's like you would want to talk with the provider that's providing that service, and just to see, what's your experience with my condition. If they've never seen it before, maybe you keep looking. But if they have, and they have a favorable response, the next is to meet with them to see how comfortable are you. Because there's people that maybe we would resonate with and sort of feel comfortable with, and that's better than somebody that's like, just not quite right for me. And so that's just a good way to sort of, is to talk with patients, or the providers rather, and then see, have they ever dealt with neuropathy from chemotherapy? If they haven't, I would probably keep looking.
So there's a lot of theories as to why acupuncture works. There's kind of, in the biomedical system, it's impacting nerves, it's somehow related to opiate releases at different parts of the body, or it's related to the fascia. What is the theory from biomedicine that you think explains acupuncture at least a little bit, or the most to you?
Well, that's a great question. If we're talking through wearing the hat of Chinese medicine, it's like we're trying to optimize the flow of qi, or the vital energy that's flowing through us in these channels, that blood, the yin, the fluids, and we do that with needles. Maybe it's flowing too fast, maybe it's flowing too slow, or maybe it's flowing irregularly, and so we're trying to optimize that way. With the conventional medicine hat, yes, it's usually more of a biochemical response, where we're causing a micro trauma, that usually most people aren't going to feel as a trauma. It's so small that it's not going to be extremely painful. The worst it should feel is if I took a hair, gave it a slight tug, it may pinch like that. Most often reported as nothing or a dull ache. But that's going to release histamine. It's going to release serotonin, dopamine, substance P. It's going to release the endorphins. We know the endorphins, the body's natural morphine, is going to be an important part, because they do studies with naloxone, which blocks the endorphins, and they notice less of an effect when they're using naloxone.
So there is some relationship with that.
Exactly. And so naloxone, you may have heard about with regards to the heroin overdoses and then doing the naloxone, because that's part of that response of that overdose is just too much of that, in a sense, morphine-like effect. And so blocking it with the naloxone.
So somebody had like pain and then they gave them acupuncture and help with the pain. And then somebody had pain and they gave them naloxone to kind of block those receptors, and then gave them acupuncture and they didn't have a...
Correct.
So it is part of it. It's definitely a piece of the puzzle.
A piece of it.
Okay.
And so, and it's a big piece.
Yeah.
And so that's the thing. It's like, so that communication, those components are always communicating locally, but then centrally too. It's like, so it's having a local response, but then there's communication with the central nervous system.
Yeah.
And so we do an MRI before and after acupuncture. We can see areas of the brain reporting pain, reducing blood supply after acupuncture. It's like we've turned down the volume on a stereo set. So the areas reporting pain, reducing the blood supply, so we're having less stimulation of those pain receptors in a sense. So it's used to sort of reboot the computer. It's like if my computer was not working correctly, I'd call IT. The first thing they'd say is to try restarting it.
Yeah.
And so that's what we're trying to do with acupuncture. It seems to help restart or reboot that missense, that missignaling that's going on, from an area that's reporting pain in the brain.
I love that idea of, acupuncture is almost like giving information to the nervous system, and maybe like it's a way for us to like interface with the brain and nervous system. Because I mean, obviously, how else would you do it? The best way to do it might be through just poking nerves, and obviously, there's other factors that play into it. It's not just nerves.
And technically, we don't want to poke the nerves.
Yeah, you don't want to poke nerves.
That's a little bit more painful.
Yeah. It's I've gotten acupuncture not too many times. But one time it was like, I think it was in my hand, and it was like right in the nerve. It was like, oh. So, when they get the nerve.
Yeah. Ideally, again, we're trained not to hit the nerves. So it may have been a strong sensation, or what we call Dutchy, D-A-Q-I, which is about the energy. And so the hand especially, that's a major we use this muscle a lot, and you can feel it.
Okay.
And especially if you haven't had acupuncture, I mean, it's like maybe
it's my first time.
Maybe the chi is not moving.
Experience.
And depending on the provider, it's like they could have been a little bit more stimulated and with a little deeper or thicker needle.
Yeah. And just to kind of wrap this up, I wanted to share a story. So the one time I got acupuncture, I had a really strange experience. So I got acupuncture, and it was the kind where they make you like hold some kind of like allergic substance or something in your hand when they give it to you. And I was kind of open to it. I'm like, all right, let's see. But what I didn't notice is that the next day, it was my first time getting acupuncture. The next day, my nose was just like super clear, and like my allergies just weren't there, and like my sense of smell was crazy. And I was like, the only thing that's changed is the acupuncture. So I'm like, we really don't know what's going on with the body. There's so many mysterious things.
Well, I mean, there is data with acupuncture and allergy response. And so again, going back to, we'll tie it all together.
Yeah.
It's like, so if I'm stressed, and as a result of my stress, my immune system is sort of hyper responding to the environment. I relax that stress. I can help support my immune system, maybe strengthen it or better balance it, so then it's not hyper responding. And so the analogy I often give, it's like a hot air balloon. And if I we have the sandbags, the ballast bags on there, sort of holding it down. And so if I am getting acupuncture and stressed, and then I relax that stress, it's like cutting those ballast bags off, the hot air balloon goes up. It's like my immune system goes up. We have data that can show that directly. Some components of my immune system enhance, and all I did was get acupuncture. But as a way to better balance my immune system, maybe I'm interacting better with the world that I am living in, so that if my immune system is in a better state of balance, and so it's not hyper responding to any allergens that then may trigger it.
And it's a way more empowering view than thinking, you're just the victim of external circumstances, that, the state of your health is up to you and the choices you make every day. And things like coronavirus, there's a lot that we can do about it. That's not just sanitizing our environment. Sanitizing our spirit and our diet also is a big factor.
And so that's the as you said, empowering. It's like we have a certain accountability for our health, which has been honestly trained out of us. When we have antibiotics developed in the 30s, and just we thought that, wow, they'd solve every condition that we had, into the 20th century and beyond. And now we know that that's not the case. So we stopped taking really true accountability and saying, my choices matter. It's like how I eat matters, how I sleep matters, how I hydrate matters. The people in my life, it can matter. It's like, do I have people that stress me out, or I have people that are supportive and I have good social support? It's like the amount of sun that I get and vitamin D. I mean, it matters. And so when we start looking at that as the terrain and saying, okay, what can I do to optimize my training? Coronavirus is not the problem. If I get coronavirus, it's not the problem. It's just a symptom telling me that I'm not in balance. And how do I help myself get back in balance? And it will be good for coronavirus, flu, influenza. I mean, it'll be good beyond. Just trying to live our life in balance is really the best way that we can do it.
So where can people find your work, and how can they get in contact with your clinic and things that you do?
Well, if they Google me, they'll find me at Providence Hospital, and that's where I am most of the time. And I am trying to get my own website, which I don't have anything on it right now, but I'll be looking for that. So Dr. Loch Chandler, and trying to expand more of the offerings, like what you're doing here, just about videos just on different topics from cancer to hot flashes or healthy choices diet. It's like, so really trying to expand sort of some aspects to enhance people's knowledge to help them balance and be healthy in their lives.
Knowledge is power, and knowing that your choices matter is empowerment. So knowledge plus empowerment equals health.
Nice.
I just made that up.
I like it. But when we look at the root word of health, it's whole. WHOLE. And so what is it that makes us whole? From our diet, our lifestyles, our mental and emotional, and our spiritual. Those all help round us out. And so thinking about how can I balance my life, that's really should be the goal.
And that's a life journey too. That doesn't happen overnight, and that's a constant thing to work on, because we can always being normal isn't healthy. You want to be like bountiful of energy and health and positive feeling. That's the state that we aim for, not just being like not sick. Because that's the typical, like, I'm not sick, so I'm fine. But like, are you happy? Are you fulfilled? Like those, I think redefining health as that is important, because that gives us, it's like the higher your ideal that you aim for, the more likely you are to get higher up. If you just aim to not be sick, like, you'll get there eventually and then you'll stop. But if you aim to be really, really healthy, so healthy that you're just like overflowing with health, then, you'll be above average in terms of how you feel about your life.
Yeah. It's like Lake Wobegon. It's all above average. But that's the presence of wellness versus the absence of disease.
Yeah.
And so we often, in conventional medicine, think about the absence of disease as in, oh, your blood pressure is absent, as in, not as in dead, but as in it's below what we would treat for a high blood pressure.
Yeah.
Or your blood sugars are in a good range, as opposed to, are you really sort of living sort of a healthy choices lifestyle that would help support that too? Or is it just due to the medication? Are you on the cholesterol lowering medications, and then you can eat whatever you want, or at least people have that idea. I can go to McDonald's, but I'm on my cholesterol lowering medications. I can have that cake. I'm on insulin.
If only it worked like that.
Exactly.
If they found a pill for that, I mean, people should probably take it. But so far they haven't.
Yeah.
So
it's really knowing that the choices we make can be very impactful for our health. And the best medicine, if you need to take those things, great. But focusing in on those aspects that can also help you is another way to approach it too.
Great. Well, there you have it, folks. Dr. Loch Chandler, thank you so much for being on the show.
Thanks for having me.
Absolutely.
Thank you guys so much for listening to the Herbal Hour Podcast. Be sure to check out our website at herbalhourpodcast.com. We're available on iTunes, Spotify, and the video episodes are on YouTube. For lovers of herbs, natural healing, and holistic health, a special big announcement for the month of April. Kentauros Therapeutics is releasing a line of mythical mixtures. These are a group of herbal formulas that are made to support a variety of issues such as sleep, reproductive health, mood, stress response, and a variety of other really important things. These liquid herbal extracts, or tinctures as they're called, are made from fresh and organic ingredients. acquired from local farms in the Portland or General Oregon area. These tinctures are deeply inspired by mythology. For example, one of my favorite formulas that I like to use before bedtime to help me with sleep is called Morphean Dream. In Greek mythology, Morpheus was the god of dreams. He would come to people during the night in a human form, disguised, sent by the gods to bring them messages in the form of a prophetic dream. It was said that dreams passed through two gates. The dreams that would deceive and would never come true passed through the gate of ivory. Those that would become true, that would be fulfilled, passed through the gate of horn. This mixture is specifically formulated to help support sleep, to calm the body and the mind, and to improve dreams. It has some of my favorite calming herbs: valerian, lavender, chamomile, and a special touch for flavor and also very good for sleep support, hops. These ingredients work synergistically to get you to rest, to get you to sleep, to help calm your mind, restless thoughts, so you can have the energy that you need to go about your day. Also, it doesn't taste too bad because we add some organic raw honey into it, because we believe that herbal extracts can be not only very potent, but delicious as well. Be sure to check out our herbal products at ktherbs.com. That's the letter K, the letter T, Kentauros Therapeutics, herbs.com. We have a variety of other formulas there, including 4 other mythical mixtures based on the gods and goddesses of mythology. We have a reproductive support herbal extract called Eros Potion, a mood support extract called Blissful Soul. We have Morphean Dream. We also have an adaptogenic blend to help overcoming stress called Herculean Strength. And last but not least, we have one of our favorite formulas, Guardian Angel, which has 4 of the best immune supporting herbs in it. Thanks again for listening, guys. Stay safe, and be sure to check out our websites, ktherbs.com. And if you're a fan of natural mental wellness and want to learn more about herbs that are specific for mental wellness, you can look into holisticspsyche.com. Thanks so much.